Okay, welcome everybody. We're going to go through chapter 1 and chapter 2 for module 1. The due date for this is actually next Tuesday at 11:59. So we're going to go right into my screen share here, and we're going to get into chapter 1 PowerPoint presentation. We'll go over the PowerPoints first. So we'll start from the beginning here. Okay, and we'll go through these. Okay, overview of the coding. We have coding careers, professional associations. We're going to talk about those. There's a couple of them that are specific to us. Coding systems and processing, other classification systems and databases, documentation and the basis for coding, and health data collections. So here's the main chapter objectives. Define key terms related to the coding. For the chapter, summarizing the training, jobs, and responsibilities of a coder and the career paths involved. Differentiate among types of professional associations for coders, health insurance specialists, and medical assistants. Summarizing coding systems and processes, identify other classification systems besides the one that we're using today, and identify how documentation serves as the basis for assigning codes. Describe health data collections for the purpose of reporting hospital and physician office data. We're doing ICD-10 CM coding, which is diagnosis coding, which is really important for the World Health Organization and the CDC to determine pandemic effects, epidemics, and things of that sort. So this is, which is really important right now in our world, our live worldview of what's going on with COVID and things like that. So we know that diagnosis and determination of geographical area is very important right now. Okay, key terms. Each chapter contains an extensive list of key terms, so we need to make sure that we refer to them and get a good grasp on their definitions of these key terms. They're boldfaced and defined within each chapter. So key terms for the ICD-10 manual are the in the alpha section at the front of the book, and we'll talk about that. They use 5 characters is what they use to establish a code, and we'll talk about that. There's no decimal points in these codes. They're strictly code sets per se, so we'll talk about those. Introduction, chapter contents include overview of coding systems, the focus on coding careers and things like that. Training that's involved, it's either, it can be, the training for a coder can either be educational and college-based, or it can be a training session or something of that sort, depending on what kind of credential you're trying to get. Internships, working at facilities, it could be clinical facilities with a physician, or it could be hospital or outpatient surgery. Any type of point of service is involved when it comes to coding. You can work, once you get done and completed with getting a coding degree, you can work in a hospital setting or a clinical office or any place that actually uses ICD-10 CM codes, CPT, and HCPCS. Careers, we've got coders in the AAPC, American Academy of Professional Coders. Those are CPCs. We got health insurance specialists, and we have medical assistants, all from other types of organizations. There are some discussion boards that you can get on and actually research and find information on. The HEMA Engage community is on ahema.org. Billing and coding forums, there's actually a website out there for that. And Part B News, which is part of Medicare. We have, again, the code sets for which the physician uses, which is ICD-10 CM diagnosis, CPT, which is professional coding, HCPCS, procedural coding, HCPCS level 2, which is any supplies or materials used by a physician office or anyone trying to get reimbursed for those. We have ICD-10 PCS, which is a coding set for hospital inpatient for Medicare. Now, medical nomenclatures, we have SNOMED CT, HIPAA has code sets, and those again are CPT, smaller code sets for the type of facility such as SNFs and things like that. And then there's also the coding reference material that you can get You can purchase the coding assistance, which if you remember in your ICD-10 book, when you start to look at it, you're going to see, sorry, it's in the CPT manual. Next quarter, you'll see blueprint, and the blueprint is actually CPT assist information that you can go back and look if you buy their journals or their magazines. Okay, I know you guys probably have heard about the computer assisted coding, which is a software system that actually helps to code and picks a code for you. Now, I know at one point we were getting really, really anxious thinking this was going to take the place of coding, but reality is that the CAC, the computer assisted coding, cannot actually do medical necessity, which is the key component to determining what level of care that a patient is having. So it's really detrimental that a human uses the critical thinking skills in order to determine the medical necessity. For example, if a patient comes in with a sore throat, strep culture comes back negative, diagnosis is sore throat, that's very low complexity. But if the same person comes in, has a strep culture, and it's positive, and they have to have antibiotics, that could be bumped up to, say, a moderate, depending on the symptoms. So there's a difference there that a human being has to take into consideration to determine the level of care based off of the two same diagnoses, but with different after effects. So you have to really watch that. So this is just some slide examples of a CAC screen. Okay. Other classification systems, we've got dental, we've got clinical vocabularies, database such as LOINC, and nomenclatures, RxNorm. Documentation is based on coding. Now, if it's not in the documentation, it never happened. You're going to hear that a lot because this is the legal document. You cannot assume anything. You cannot read into anything. It has to be black and white on paper. Reporting hospital data is on the UB04 claim, which is the hospital-based claim that they actually submit to the insurance for reimbursement, or the physician claim, which is the CMS 1500 claim form, which is submitted to insurance companies for payment for physician services. Health data collections, automated case abstracting software can be done. Cancer registry is another health data collection specific to geographic areas, types of cancers based on how they're labeled, numbered, and whatnot, to determine, looking at the data, what type of services or treatment they're getting in order for it to be curable or helpful. So that's a type of software database system that they use. Claim submission to payers, again, the claim forms are CMS 1500, UB04 is for inpatient. And they can take that information, put it into the database, and then actually pull and extract the information out to make it make sense. So it goes in as data and it comes back as information, okay, once you clean it up. All right, now we're going to go in and we're going to look at the slides for chapter 2 really quick. I'm going to do them both at the same time. So looking at slides number 2, chapter number 2, Introduction to ICD-10-CM and PCS, we are really only going to be looking at ICD-10-CM, but it's nice to review, and I'm going to tell you there's a reason for this, for the PCS system, and that is because there is some information in your prep class, if you're taking it, just recognizing what PCS is, what kind of system is and what's its use for and how it's built. So it's important for you to know this. And again, during the prep course, if you're taking the prep for the CPC exam, we'll go over it again. So the outline for this chapter is an overview of both systems, the CM and the PCS. The CM is the Diagnosis, Diseases, and Injuries Database System. PCS is Index and Tables. We're going to talk about that. And CM and PCS Guidelines for Coding and Reporting, and ICD-9-CM Legacy Coding System. Now, we're still talking about the old system because it's still it's a history leading up to what we have now. And believe it or not, we're on ICD-10 right now, and a lot of countries, other countries are actually using 11, and there is a 12 out there. So we are a little behind the times. We were the last ones to get on board with 10. So, and it took us 3 years to get ready for it. We were in a stall pattern for 3 years before we actually went live. So 3 years of not having any new codes, which is unbelievable. But anyway, all right, so this is our objectives at the end of this chapter, what we should know, and we're going to move on to, okay. So this is an example of a 1500 claim form for medical for doctor, okay? Medical necessity block 21. So block 21 is right here, and this is where our diagnosis codes go. This is actually a diagnosis code from this is actually a diagnosis code, these two here. These are ICD-10 CMs, the new codes, okay? And this is where they go on a claim form, and these correlate to the codes down here, or the procedural codes. These are the procedural codes of which we're done. It looks like there might be a pathology code here and an S code, probably supply, okay? So diagnoses for these are, for this one for the office visit, they have both of these codes. So one of them is diabetes, I do believe, and the other one I'm not sure on. Okay, and then this one here, only the diabetes code, and this one here is only, this code here is only the first code. Okay, so there's where these, this is your linkage for the diagnosis to each specific procedure that's done. Okay. It's a sprained wrist, I guess is what it is. Okay, so there is a decimal point in the I-10 codes. It's after the third character. Everything starts with an alpha. That's the difference now. It's an alpha code. So we had a sprained wrist here, okay, and it looks like it's the initial encounter because it's an A. So the diagnosis for the wrist was going with here, the first A and B, okay? And then the second code, which is looks like a path or something, that's going with the diabetes code, and then blood glucose test probably, okay. And then we have an S code here, which is actually going with the sprain, okay? So this is probably, it could be radiology or something like that, okay? So that's how that all works. It's just kind of that's how the diagnosis goes with the procedures based on what they correlate with, okay? All right, classification of disease and injury according to specific body systems and the etiology or cause of the disease. Disease and injuries codes consist of a minimum of 3 characters. Most are followed by a decimal point, and then at least 4 more characters after that. And this here is an X, and I'm going to talk a little about that in a little bit, but that is a placeholder, and we'll talk about how to put that placeholder in there. These are the chapters for the ICD-10 CM book and manual, the coding manual, and you can find these at the front of your ICD-9 CM book. And that's this book right here, your coding manual. Hopefully you guys have all got it. At the front of the book, it will tell you the table of contents, and in the table of contents, it will show you all the chapters, okay? So that's where you can find that. Okay, categories, subcategories. Oops, I'm getting a little crazy here with the, okay. And categories, subcategories, and codes. Categories have 3 characters. Subcategory is the 4th, 5th, and 6th, and that X if you need it for the placeholder. The final level of subdivision is a valid code. Okay. Disease and injuries, alphabetical list of main terms are in the front of the book. The main terms are printed in boldface. So that is the main term you're going to look up, and then you're going to drill down or look down to find the rest of your code based on the information that's given you in the scenario. Okay. There are some tables in this book. There's the neoplasm table. So if you go to the end, oh, let me see here. If you go to the end of the alpha section to the Z's, you will get to right into the neoplasm table. And my book is page 331. Okay, that's where the neoplasm table 330, 331 starts. Then after that is the drug and chemical table. That one starts on page 349, I do believe. Wait a minute, hold on. That's, yeah, table of drugs and chemicals, 349, okay, in my book. And then there's the index to external causes, and that one starts on page, it's right after the drugs, so it starts on page 398. Okay, so those are the tables that are in the books. Those are places of which we're going to look at, so don't worry about it, but we'll get into those. Okay, now this is an example of what your book would look like if you're looking to find something as far as a diagnosis. Okay, so let's drill down further. Let's go in your book, your ICD-10 book, and we're going to go to, let's go find in the front of the book, in the alpha section, starting on page 1, disease and injuries index. Let me see if I can get this turned on for you. I don't know if this is going to work, but we're going to give it a good shot. Let's stop sharing. Let's see here. Let me see if I can get. I don't see stuff. It's moving. Okay. Okay. Ooh, look at that. Okay. Let's see here. I thought I had this where it actually worked, but it's backwards. So can we flip that? I don't know if you can see that or not, but this is really what your book looks like. I don't know if I can get this to go any, here, let's see if we can get that to go bigger. Okay, okay, it's still backwards. Okay, I might have to play with this a little more because it's still showing backwards. It was a nice thought. Okay, wait a minute, we can turn it around. I still think it's backwards. It is. Okay, so much for the hover cam. Okay, so we won't be using the hover cam. All right. Okay, so let's go back into, I'm going to go into here and we're going to go back into video. Okay, so let's go back into our screen here as far as the PowerPoint is concerned, and maybe we can see what the book, if it gives us a detailed look at the book. We did that. Okay, so for example, if we got into, I think it's here, they show you some examples of what you can find in your book if you look at it. Okay, now what I want to do is I want you to go to page 1 in your ICD-10 CM coding manual, and I want you to look at under abnormal, so find the main term that's in bold that says abnormal on page 1, and I want you to find abnormal blood level, copper. So abnormal is our main term. We're going down to blood level, and from there we're going to indent in until we find copper. Okay, and we find a code R79.0. Okay, so in the back of the book, in the color section of the pages, we want to go to R79.0. So we want to find the codes for R's. It's an orange, it's orange on the side, and we want to go to R79. R79.0 is this, and when you find it, it's on page 942. It says R79.0 and normal level of blood minerals, and that includes all of the things that are underneath it, including abnormal blood level of copper. So yes, it does match. So then we're going to go and we're going to write down our code. That's going to be the code that we use. So that's how we use the book. Okay, is that you look up your main term in the front of the book, you go down, drill down, find your code, and then you go to the back of the book and you verify it to see if it's correct. Okay, when I say drill down, that would be go to, for example, on this page, abdomen, abnormal, drill down to acute. So drill down means look down till you find acute and find your code. Okay, so that's what I mean. So a lot of times, if I give you instructions, if you send me an email, I might say, okay, go to main term this, drill down until you get to this, then go down until you get to this. So that's what I'm talking about. You keep going down until you get all of the stuff that you're looking for. Okay, so in here, they're just telling you that if you're looking at the main term, or it's going to be admission, for example, and then the subterm is going to be underneath it, adjustment. And then the second qualifier is going to be indented even further. And then the third qualifier and fourth qualifier and stuff. It depends on how far it drills down and is indented in. Okay, so that's just an example of that. So basic steps for coding. First, you want to find the main term in your index in the front of the book. All right, now you don't want to use body parts. So if you got a foot problem, you don't want to look up foot. Okay, you want to look up the problem. Okay, is it pain? Is it abnormality? Is it failure? Is it disease, disorder, malformation? What is it? What's the problem? And then you go to the body part after you get to that main term. Okay, you will see some things that say C also, C category, C condition, which means that you've got to look at something else, that you are not in the right place. Okay. Use a multi-axial 7-character alphanumerical structure, and there's always 7 characters. So what happens is that there's some information here on PCS. Okay, so the deal is with this is that with ICD and CM is that if you don't have enough characters, you're going to have to put an X in there. So let's go to the back of the book into the color section, okay? And I'll show you how to add an X, all right? I think the M section probably will do it. Okay, you can have up to 7 characters, but sometimes you're going to have to fill the gap. And filling the gap means you have to add the X, the placeholder. Okay, so I'm trying to find an M category that gives me a box. And watch, I probably won't be able to find any because I'm just randomly looking. Let's see if S is T's. Oh, here's some T's that have to have it. Okay, So if you go to page 1107 in your coding manual, you're going to see under T44, it's a poison by adverse effect of the undosing of a drug or primary affecting the autonomic nervous system. T44, and it's on page 1107. If you look down T44.0, next to it, it says you need to have 5 characters. So when you're done with coding this, it should have 5. You have to go down even further because that only gives you 4. So to get your 5, you have to go down further. So the next one is a T44.0X, and that gives you 5. But this one here says right next to it that you got to have 6. So you got to go down even further. So T44.0X1 gives you 6, but it says next to it you need 7. So based on this, you have to find your code in this code set using OX1, 2, 3, 4, 5, 6, one of these codes. And at the end of that code set, or that code that you find, you have to add either A for initial, D for subsequent, or S for sequel. So is this the initial first time they're being seen? Is this a subsequent visit, or is it something that's going on for a long period of time? That is your alpha that's going to be put on the back side. So pay close attention to those little red boxes that you have next to there that indicates to you how many numbers or characters you need for your code that you're looking at. Okay, so down below this T44.1, next to that it says it needs 5. If you go down further, it says it needs 6. So you have to go down further to indented to the T44.1X1. You got to use one of those codes. There it says it needs 7 characters. So you have to go back up and put that, determine if it needs an A at the end, a D at the end, or an S at the end. Okay. The only other thing is the X placement holder, and that one there, we will discuss it when we get to it, because I don't want to confuse you any more than I probably already have already. But at least we know that we have to look at the alpha section and drill down to get to our code. Then we go to the back of the book and look it up. And then from there, we determine what our code is. We look at the red box to see how many characters they have and make sure we have all of our characters. Okay, that's pretty much it in a nutshell for that. Okay, so now we're going to look at homework for this week for chapters 1 and 2. So we've already talked, the video discussion board is about billing versus coders, billers versus coders. So post your first response and post to somebody else by the time before next Tuesday, before the module closes. Okay, I'm going to go into the textbook review and we're going to take a look at that for chapter 1. And then we'll look at the chapter 2 review real quick. And then that's pretty much it for this week. So if we preview this one really quick, like, let me see what we got. I think this one is pretty much fill in the blank, if I'm not mistaken. So it shouldn't be too bad. And it could be information based off of what's in your reading. And it looks like it is. So all you have to do is put the letter answer in on what your answer is. You don't have to type anything but the letter, and that's what the descriptor says. Okay, you do not have to do any coding for chapter 1. Okay, so now we're going to go back out and we're going to go look at chapter 2 review. One more time. All right, chapter 2 review. And we're going to preview this and see what we got. This one's worth 25 points. Okay, fill in the blank, fill in the blank. Okay. All right. This one here would be based off of which code appears next to the subterm. So that's really easy. That's not coding to the full extent, but if you look under contusion and you go down to arm, which code appears next to that code, next to that arm, okay, is all you have to put in there. That's all. Pick A, B, C, D, A, B, C, D, A, B, C, D, and oh, we have some coding. Okay, here. Abdominal hernia, all you have to do, first I want you to put what is the main term, what are you going to go to first, and then put a comma, and then I want you to put the code. Okay, so you're going to go to, I don't want to give you the answer, but so I want your main term, it's either abdominal or hernia, and then from that I want you to tell me what the code is once you go and find it. Okay, 17, abnormal non-fasting glucose tolerance test. What is your main term, comma, and then go find the code after you get to the main term, and then tell me what the code is. Okay, make sure you get all those characters so you know what you got to do. Every single time you look up something in the alpha section, you have to look at the back of the book to make sure you have all of your characters. Okay, because you can only half code if you look in the front, and it's not correct unless you have all those characters. Okay, acute otitis media, which one is your main term? Now this is actually, acute is actually describing something. So acute is always something that's going to be drilled down once you get to that main term. So you have to decide what your main term is, comma, and then go find your code after you see that, and then put it down there, make sure verify it in the back of the book. Hyperplasia of the endometrium. Endometrium is a body part, so you can't look for that. So that process of elimination, again, main term, comma, and then your code. Okay. Traumatic fracture, closed right humerus, initial encounter. This is going to tell you right here. Remember when we saw those pink boxes in the back of the book when we were looking? You're going to have an alpha on the back of this. So make sure it's probably going to have 7 characters. So make sure that you look for it. Okay. Main term, whatever that is. Remember, it's not a body part. It's actually what is wrong, okay? And then this one here, congenital fibrocystic disease of the lung, fibrous pulmonary congenital, okay, there you go, I kind of gave you some information. Main term fibrosis, P27.8, no answer, text provided, no answer, text provided. Oh, I might have given you, well, that's not right. I think I gave you the answer. I gotta fix that. Okay, so, and then that's the rest. So it should be fine. You should be able to do those, okay? Any questions, please let me know, okay? But I think we're good, okay? So, good luck. Email me if you have any questions. If you want to, save your questions until Monday, and then we'll go ahead and go over and during our Monday's lab. Monday lab will be at 7 o'clock, and I will post your lab link in there if I haven't done so already. Okay, thanks.